Dr. Ed Williams here. Thank you so much for watching my YouTube videos. What I'm trying to do in this fireside chat is to talk about what are the benefits and try to decrease the confusion around Botox versus fillers. A lot of people don't know the difference of what Botox is versus a filler. So Botox and other what they call neurotoxins, neuromodulators, actually relax the muscles of the face, those that may be a heavy frown or around the eyes from overactive muscles. So that's what Botox and what we call neuromodulators do. Who are good candidates for fillers? People with volume loss and people with wrinkling and hollowing. Now, if you think about the aging process, what happens is we get into our 30s and 40s, we start to lose a little volume, we start to develop a loss of collagen in the skin, and things start to drop. So aging is a multifactorial kind of multi-combination thing. So it's not simply good to treat just over-treat one area if you want patients to have natural results. So Botox is typically, it's FDA approved for the frown in the area between the brows, around the eyes. For someone who maybe has a very heavy brow, you can cheat with a little Botox to bring that up. In the upper lip, for people who have a lot of wrinkling around the mouth or a downturned mouth. And then the other application works really good is for excess of sweating, which is called hyperhidrosis in the hands or in the armpit, which is embarrassing for individuals. So let's talk a little bit about recovery. Recovery time for Botox is basically nothing. I mean, I have Botox and I go back and see patients the same day. Some of the fillers, and there are a lot of them out there, we tend to gravitate toward what we call the hyaluronic acids. Those fillers work best, and there are a lot of different ones with different molecular structures, but what we like about hyaluronic acid for fillers, for example, thin lips, or maybe what we call marionette lines or hollowness in the cheek, is that it's naturally found already in our body. It's found in our joint fluid, and it's very supple, and it's like a gel, and it lasts. All of them last between 8 months and a year and a half, and it really depends on what's the best filler for the certain application. And being a practice that is in the top 1% in the country of volume, we get really pretty good at adjusting those and customizing the treatment to the individual. So what are the costs? The fillers typically end up being between $400 and maybe $1,000. Recovery period, you may get a bruise or two from non-surgical fillers or volumizers. Botox, the cost ends up being several $100s. Sometimes it can even maybe reach $1,000 if someone's having a lot of areas treated. So it's important to remember that Botox decreases muscle activity, resulting in decreasing the lines. Fillers add volume to help with the lines and add where we've lost volume in the face. Botox and fillers tend to work synergistically. In other words, they work together to give us a more youthful, less tired look. So for more information, you can look at our YouTube channel, which is YouTube/Williams. I have all frequently asked questions you could possibly imagine about facial plastic surgery, as well as non-surgical treatment. Follow me on Snap, Dr. Ed Williams, all small case, or you can check out our before and afters at williamsfacialsurgery.com. Thank you so much for watching. I appreciate it.